Hey guys, here today to talk to you about visual impairment. Some topics that we're going to hit are the health effects of visual impairment on certain individuals, what exactly is considered visual impairment, the different types you can have, how exactly you can get it, also different safety concerns for them when you're exercising them, as well as different adaptations that you can use working with them. Okay, to start off, what is visual impairment? I have some definitions for you. Visual impairment can be defined as limitations of actions and functions of the visual system. The National Eye Institute defines it as low vision as a visual impairment not correctable by standard glasses, contact lenses, medication, or surgery that interferes with the ability to perform activities of daily living. To go into this, there are things like complete blindness. There's being legally blind. Usually people who are legally blind can see different colors and shapes of different sorts, so they still have their vision to a point. But I do have some experience with this, as my grandmother is blind in one eye, kind of. She gets actual shots in her eyes to help clear it up. She sees like black spots in the distance. Usually up close, she's fine, but her far away vision usually gets blocked out with these what she defines as black spots. So there's a lot of different visual impairments out there. Not everyone is just completely blind and just can't see at all. And I'm going to go into a little bit further detail in my next slide. So, types of visual impairment. The World Health Organization has used these points here to define visual impairment. I'm sure you guys have heard of the 20/20 or 20/20 vision. It's a scale that they use. 20/70 to 2400 is usually considered moderate visual impairment. With these, you can use correctional tools like glasses, contacts, or even like LASIK surgery possibly. Legal blindness is 20 to 200 or worse. This also can be defined through the field of vision. So 20 degrees or less would be considered legal blindness, and complete blindness would be 20 to 400 or worse, and with a visual field of less than 10 degrees. So these are just some different types that are out there. So some causes of visual impairment include glaucoma. I'm sure we've all heard of this before. It's cancer of the eyes. It can cause blurry vision, complete blindness. Just like other cancers, it can be fought with chemo. It can improve, possibly. Macular degeneration. This is basically deterioration of the eye muscles, so your eyes can't dilate properly. Cataracts. I'm sure this is one that people have heard before. Often you see people see symptoms such as double vision. They can't see light well. There's a lot of clouding. These are symptoms that they'll get before they go completely blind, if they do. Diabetic retinopathy. This is actually the leading cause of blindness in adults today. This also has black spots, floaters, lack of blood flow, and often these are symptoms right before people go completely blind as well. Then there's retinitis pigmentosa. This is actually a genetic disease that is inherited. It often starts with night blindness, which then turns into tunnel vision, then loss of peripheral vision, and then mostly ends up to be complete blindness eventually in life. Then there's circulatory problems. That's basically not getting enough blood flow to the eyes, not getting them oxygenated, which often leads to complete blindness if the blood flow isn't fixed. There also is injury to the eye or heads. I mean, you get a pen in your eye, and obviously there's a good chance you can lose your eyesight. There's actually a baseball player for the Phillies, I think he was a pitcher, who was using bands, and one of the bands snapped and hit him in the eye, I'm pretty sure, and his career this past year because he couldn't see. And also, head contusions, like concussions and such, can have effects as well with the neurology. Now on to health implications. Studies have shown that visually impaired people are often show lower fitness levels compared to their peers. This is often because people assume that they can't do everything that we can do, when that's usually false. They can usually do absolutely everything that we can. They just need some adaptations. Also, studies have also shown that their daily task requirements cost more energy because they're using different senses, they're moving around a lot more, trying to feel out their surroundings. And mostly, for the most part, physical activity and exercise have just as good health effects on them that they would have anyone else. So the exercise protocol, these are some of the simpler ones that you don't really need to adapt to do. You have stationary bike, treadmill, row machines, weight machines. Usually these are the best way to go to start with, just because you don't really have to worry about them running into things or anything like that. Free weights, always need a spotter for free weights, because, putting them down, I'm not really sure where it could possibly go. There are definitely a lot more things that you can do with certain adaptations, which I will get into shortly. So exercise adaptations, some simple adaptations that you can do right away are a sighted guide. You can just have them hold on to you if you want to run with them or something like that. There are guide wires that have actually a PVC pipe through the wire that you can run and hold on to the PVC pipe, so they're not holding the wire physically. Tethers, you can have a tether tied to the sighted person and the visually impaired person, and that one actually allows them more freedom. They're not having to hold on to anything. If they're going off course or anything, you just pull on the tether. Callers, so you just yell their voice or their name so that they can hear you, and then they would just run to the voice. Tandem bikes, of course they're not going to be steering, they'll be in the back, and you just steer and they would go along with you. Swimming, usually for people who are probably legally blind, that can see the black strip along like a pool, and they could see the end coming before they would actually hit the wall, or even just treading water. Someone completely blind can just tread water. Tactile floors, so when they're running, when the track changes like to a different surface, they can tell, and that's their indication to stop. These are all adaptations that really don't take a whole lot. Some different adaptation ideas for sports specifically. For ball sports, I've seen basketball adaptations where more or so not completely blind, but hitting the rim is a point and the backboard is a point. Things like that, that's mainly for people who aren't completely blind. Games with bells in the ball or beepers in the ball, like soccer balls with beepers in them, are often used. For bright and contrasting colors is mainly for, of course, people who aren't completely blind. Makes the sport 100% better and easier for them to follow. It's important to emphasize communication skills for both the coaches and the athletes. It's using other senses other than their eyes. That's really the focus, is to key in on other senses when working with them. Goalball is a sports designed specifically for the blind and uses a bell ball or a goal ball, and the object of the game is 3 players per team. The object of the game is to get the ball across the opposing team's end zone or line to score points. That is actually also in the Paralympics. And here's a list of a bunch of different sporting events that are in the Paralympics: archery, track and field, cycling, equestrian, sailing, shooting, swimming, skiing, goalball, judo, swimming. Of course, all these are definitely adapted to the athlete's needs. When working with a visually impaired individual, it is important to emphasize safety. You want to give them in-depth directions, be as detail-oriented as you can be. You want to show them if it's a sport or something, or even just a facility, show them around, get them used to it. Remove anything that they could trip on, any hazards that don't need to be there. It can be removed. If you're guiding them or you have to show them something or you're showing a certain movement, you should always warn them before coming in contact with them, because you most likely are going to have to come in contact with them to show them how a movement should be performed, because you can't show them by trying to visually do it. You either have to describe it very well or physically touch them, and you should always tell them beforehand where you're going to touch them, and ask if their permission if it's okay. Also, it's important that once they are familiar with the area and where all the equipment is. You should not be changing it around. Once they get used to it, that is our goal, is them trying to get used to an area so they understand where they are in the space around them. Are 23 years old with a BMI of 23. His blood pressure is 132/86. He's a non-smoker and is adopted with no medical history. His LDLs are 146 and his HDLs are 68. He's currently inactive. His fasting blood glucose is 98. He's also a type 2 diabetic. He takes insulin. He is also legally blind. Okay, so let's see where he is at risk. His family history, we're not sure if he was adopted. His BMI is below 30, so that is not a risk factor. His blood pressure is below 140, that's not a risk factor. He's a non-smoker, not a risk factor. He's inactive, which is a risk factor. His LDLs are at 146, that is a risk factor, but his HDLs are above 60, making that a negative risk factor. Fasting blood glucose would be under, and it would be a non-risk factor, but since he is a diabetic and does take insulin, that would be higher normally, so that is a risk factor. He's also legally blind. So he ends up actually being at moderate risk. As for how I would go about exercise testing him, since he's a diabetic, I would electrocardiogram him. Often do this with most diabetics. For cardiovascular, you do Meyer stage test. You use a bike, since he's blind, it's probably the best way to go, and especially since he's inactive and he's not used to doing too much else. For resistance, we're using machine weights, 1 rep maxes. We're doing upper, lower bodies, pushes and pulls, just to see where he's at with that. And we're using machines again because he's legally blind, and it's usually a little easier that way and simpler. Range of motion, we're just simply going to go with goniometer. As for my exercise prescription, aerobically we're having cycling or swimming at a 40 to 60% VO2 max. We're giving him some options. He's legally blind, so this will be okay. You can see the black line at the bottom, so you know before you look at the wall. Probably between 20 to 60 minutes, 3 to 7 days per week. You want to try to get him on the higher end of that, longer time, more days. With resistance training, we would do him 2 to 3 times per week, 60 to 80% of his max. Focus on large muscle groups, compound exercises mostly. As for range of motion, we probably do a dynamic warm-up for stretching. I probably have to show him through it and stuff like that, just so he can understand what we're doing. Probably a static stretching for the cool down, bring his heart rate down. Some adaptations, auditory, be very descriptive. If he's running or something like that, tactile again, which I talked about earlier in adaptations. I could also run with him as a guide. We could do tandem bikes. There's a bunch of different adaptations, which I discussed earlier, that gives you really a lot of options to go into. In my conclusion, I just have 2 points that build into each other for visual impairment. The first is the health effects on them is usually the thought that they can't do something, or people don't talk to them about getting out and exercising because they think, oh, they can't really do a lot because they are visually impaired. And that is usually the exact opposite. There's really nothing physically holding them back. I mean, almost every or all of these exercises can be adapted so that they can do them. Even sports can be adapted. So my main point is, for the visually impaired, there are really no limitations for them.